postpartum usually, I mean, they define it as the period after you give birth and you're recovering and getting your body back to the original pre-pregnancy state. Right?
Been 4 years.
So maybe you're still postpartum right now. But you know what? Some people, actually a lot of people think postpartum just really means postpartum depression. You know, so a lot of times women will come in like, oh, I never experienced postpartum, or I'm like, well, you must have if you've given labor, because that's the time period when we recover, right? Have you guys, is this your first, that was your first, do you have any children?
First one, 9 months.
9 months.
And as I'm still nursing, and as we got you, I mean, postpartum, I think it's pretty long.
It's long, and the time that they give you, it's really just 6 weeks, to recover, and it's not enough. And actually, studies have shown that women who go back to work too early, they're less effective working because it's too early, and plus you go back to work unpaid. I mean, if you don't go back to work, you get unpaid and you stay home. Back in the days, giving birth, it takes a whole village to take care of the family, because if you just have the mother and the father, it's really hard. I'm really interested in this topic because I see here in the bookstore, everything is baby this, baby that. How do you breastfeed? How do you do this? Learn to this. The first year of baby, everything about the baby. But what about the mom, right? What about mommy 411? We have tons of baby boom, but there's no mommy 411, I would probably say in a lot of the countries, there's a lot of emphasis on care for the mother. In New Zealand, they have the best health care after the mom gives birth. They have the nurse that comes to visit the home to make sure they're doing well, to ask, how to breastfeed, everything. They go in for checkups. Here, basically, you give birth, and the doctor pretty much says, oh, I'll see you in 6 weeks for your checkup, unless something happens, right? But you don't want to wait till something happens, So in the East, my mother used to say to me all the time when I was a little girl, I'm coming to stay with you for a month after you give birth, and to do this thing called 坐月子, which means, literally kind of like sleep. And I'm always kind of wondering why she's gonna come and stay with me, but just take care of me, because there's such emphasis on that, and it's almost like a ritual. People in Asia now, they have places actually. You go after you give birth, and they have nurses there. Pretty much the mom stays there, and the baby and the father, and they have nurses coming in, taking care of the baby, and also taking care of the mom. And I think it's so important because I think in here,
it's so hard. I think
it's so hard. You're not prepared for it. You don't know what to expect. And I think here, I got really interested in because I was seeing a lot of patients who are coming in with chronic headaches after they give birth, chronic insomnia. I think that's the most I've seen. It's chronic insomnia after, they were sleeping fine before having kids, joint pain. Usually I see joint pain, that's usually immediately, I would probably say a couple weeks after labor, joint pain, postpartum arthritis, and even, a couple of postpartum depression, and even some severe depression, and not getting help. I had a patient who came in for postpartum depression, and she was taking care of the baby by herself. Her husband worked full time, and she wouldn't even tell her husband how she was feeling. She didn't want to burden him. And there's a lot of women who are giving birth later on in life, and they actually really need to replenish more, because you're really working with your reserves. So I think it's important to know what to eat to really get your body back in health, and what to do during the postpartum time.